communications and health promotion. So we are looking at health promotion. And last we started talking about communication. So we just want to continue from where we left off last one we met. So we want to look at the principles of communication. Last we started by behavior change communication. We identify various procedures and we also move on to look at the communication itself. And we also look at the traditional communication mediums and all that. So this evening, I want us to look at, there are principles that you also need to have when you are a communicator or health educator as part of your health promotion activities, so that you'll be able to communicate and your findings, whatever you are talking about, will be clearer to people to understand. So those principles are critical for us as health promoters. And one of these principles is you have to, as a health promoter, you need to provide a comfortable setting with few distractions. The environment that you are going to provide communication, eventually communications that we want to change behavior. That's the most important thing that we have to bear in mind. And the environment where you are going to provide this counseling or education to change the behavior should not be distractive. Should have some kind of a privacy. Because if you are, especially you are counseling people and the place is not private, you see that people will not feel comfortable. If, for example, I'm HIV positive and I came to your clinic and other people are sitting there before you already counseling me on HIV, do you think I'll feel comfortable? I will not, because it's stigmatized. So I don't want anybody to be in your office. I just want it to be between two of us. So the environment should be sanitized, should not be distractive in terms of physical environment, biological and the social. So you talk about social issues, the physical issues, and then when you talk about distractions, biological, we also look at for your communication. Was the person have any disability of hearing you? Maybe is challenged in terms of hearing, or maybe it's a sight and all that. So all those biological issues can also affect the comprehension of that particular thing that you are communicating to your client. So you look at their physical, whether they are fit, and the environment is not distractive as well, and then sitting arrangement, they are feel comfortable. And also biological aspect, we are saying that you have to assess them whether they are physically challenged, they are hearing impaired, that they will not be able to hear what you are saying, and the method that you adopt so that they will be able to comprehend what you are saying is very important in that area. You also look at the social issues. We talk about, you see, people that you are talking to, look at, especially if they are in their social class are not the same. It's difficult for people of that nature to speak. You remember when we talk about focus group discussion research, and I said that most of the time when you are bringing people together, look at their socioeconomic status or their status in society. Else, if you put educated together or doctors, nurses together, and you're adding cleaners to them, they won't be able to talk. The same way apply to communication. If you are talking to people of this some level of caliber, and you have people who have not reached their level and you are talking to them, it's difficult for those people to ask questions. So you must look at all of those things when you want to do your communication. Then also focus on listeners' needs or interests. As for the needs of the people, we look at that. We have expressed needs and felt needs. And then all of these have to be looked at effectively, the interests of your people. So I made mention that in the communication, especially behavior change, you must look at the needs of the people that are involved. And if you remember, I made an example of maybe you are educating people on menopause. So you are targeting women 50 years and above and all that. And when you are bringing adolescents who are young, maybe they just start menstruating, you are talking about that. It's not something that they are interested in. Therefore, they won't even listen to you, because that is not something that they prioritize at that particular time. So you must also focus on the needs of your listeners or things that interest them. Other than that, you know, achieve your target. You must also be brief. Some of us, we are talkatives. Some of communicators, they are talkatives. They talk too much. So be brief and concise about what you are saying so that the person will get the central key point you are talking about and move on. So don't go and repeat yourself over and over again. And then just be brief, make your point clear, let the content be clear for them. So do not give too much information at a time. So some of the things that you can also, but you can involve yourself in what we call info. I think I even forgot the name. When you give too much information at a time, there's a name that we give to that. If you get, you can remind me. So when you do that, give too much information to people at a time, that is, it becomes too much for their comprehension. So just give brief talk at a time, or the message. Yeah, I know information overload, but there's a term that we use for it. There's a term that we use for it. I can't hear you.
Because
Is that? Hello.
hello, I said, like, is it information? Is it ambiguous?
No. When I remember, I'll tell you. But that's not what I am referring to.
Okay.
Then you must also use words that are familiar to the listener. Avoid technical jargons. The person you are talking to is a lay person. He's not a PA like you. So when you are using your professional jargons and technical jargons, you or she will not understand. When you say you want to chase somebody vitals, the person will be looking at you. I say you are coming to take temperature and so the person will understand what you mean. But if you are using terminologies that are understood by only health professionals or your colleagues, and you expect that person to understand, the person will not get what you are saying. So it is always advisable that you use language, simple language that everybody will understand. They also use two-way communication. Last time we identified some two-way communications, that lectures, discussions, role play, and all that. Avoid one-way communication system that we have, like talking drums and those ones. Those ones will not give much of talking to others who are part of the listening. But when you use the two ways, they listen to you, they respond and all that. It's a way that you encourage them to ask even questions when they are not comfortable or they have some issues that they need clearer understanding. They will be able to approach you. So it's mostly important that you use two-way communication channels. If you, in case you have forgotten, I can take you back so that you have a look at it.
Amen.
If you look at this, you see the traditional one, the best, chief, traditional, and all those things. But if you look at they are all one ways communication issues. But if you look at the interpersonal communication, that's demonstration, discussions, health talks, counseling, role play, lectures, church most. These are the one that we can classify as what? Two-way communication skills. Two-way communication channels, sorry. Two-way communication channels. The first ones are what? One-way communication channel. That's what we talked about last time. So you can talk about demonstrations that you demonstrate for people to see how things are done. You can talk about discussions, health talks, counseling, role play, and all that. Those are the one we are referring to as what? Then the often two-way communication, those are the more effective one that we use. And I talked about them last time when we met. Okay. So communication skills, comprehension, your communication skill, you must be ability to understand. You yourself, if you don't understand, you can't give. You see, what you don't have, you can't give to others. So you yourself, in other words, you might be knowledgeable about all the things that you want to talk about. The knowledge is the first and foremost important thing that you need to have. If you don't have the knowledge, how do you give to people? You can only give what you have to others. So you yourself, you must be knowledgeable. If you want to talk about HIV today in Ghana, You should have all the statistics. Tell them the prevalent rate to this is 1.6%. The population that are fueling the figures, that is men who have sex with men and the female sex workers. These are the two groups that are always increasing the figures in Ghana, especially among men who have sex with men. It's so common as compared to the prostitute. But we are saying that the female sex workers and the men who have sex with men, they are the two driving force when it comes to HIV in Ghana. They are the people who are driving the high numbers that we have. So you must have all of this and educate people that things have changed. In those days that somebody who is HIV, you see the person growing and all that, that's a giving indication that this person is HIV positive. Those things are no longer the case today. Today, people who are HIV, they are living comfortably. They even look beautiful than you and I because of the drugs that they are taking, the ARTs that they are taking. They look so nice. So if somebody tells you that this person is HIV positive, you will not believe it. So these are the things that we need to let the people know. If you don't have understanding, you yourself, you don't know the concept, you don't know exactly what it is, you'll not be able to provide that education to others. And I repeating, you must be active listening, or you must be active listener, be able to summarize or being able to paraphrase, probing and appraising. So what you need to, you should be able to summarize your points. You should be able to summarize your points. Don't go and give the whole, let's say, 30 pages, 20 pages for people to read. They will not even look at it. So try as much as possible to summarize your points. 2, paraphrase, not to repeat as it is in the book. Try to paraphrase whatever you want to say, brief and nice and a simple language. Also be able to probe. Probing is what? Asking questions further so that you understand other issues, the clarity, to get clarification on all the things that you are talking about. So be able to ask probing questions. As we did in the research, we discussed that probing questions are very important. You probe further for things that you do not understand so that you can get the understanding. That is very crucial. And also moving forward, look at, you praise the people. When they are done well, praise them, clap for them, acknowledge that they have done well to motivate others to also come forth and talk. So it is always important that those who are doing well, try as much as possible to congratulate them, motivate them, praise them, so that others who are not talking, that can also ginger them to also speak. When you do that, you will see that others will also be willing to talk to you because they have seen that you have praised them. If you have tough, that draw people attention to whatever you say because they want to listen carefully, ask questions, or be able to respond to your answers. So you can also get attention. Then observation of nonverbal communication skills. I don't know if I talked about this last time, but I was saying that even if you look at people, when you are communicating to them, whether they are following what you are saying or not, you get to know how they react. They will not tell you, they won't talk to you about it. But if you see the way they are reacting, nobody will tell you that, oh, no, these people are not following what I'm saying, or they are tired of what you are doing. Therefore, none of them will mind you. So you must always pay attention to non-verbal communication of people around you, especially when you are speaking to them. Whether they are following what you are saying or not, you see it in their reactions. The use of audio visuals, sometimes because of the numbers, the population. So use public address system. Those are the things we are referring to, audio visual. Use radio videos, play them for them to see. Use giant screens so that they can see what exactly you are talking about before you also speak to it. I always believe that people think things that they watch stick with them than things that you are just talking about. So when you show videos, show demonstrations, screens and all that, they become interested and they will, as much as possible, try to remember some of the issues, even when you are no longer there, because they watch and being played, they'll be able to remember some of the things that you are talking about. So it is important all the time that if you have the opportunity and you have the resources, you use demonstrations, use a gadget that will make it easier for people to see whatever you are talking about. Then you must always be ready to provide feedback and receiving feedback. Provide feedback to people. When you realize that they are asking questions, please provide feedback. You have undertaken a project together, come back and provide feedback. At the same time, you also need to receive feedback. Go back to the community. Ask them whether things are being done the same way it has been done previously before you came into the community. So it is important that you also have to go out there and seek feedback from the community. Not always you are giving them feedback, but also go to the community and receive what? Feedback. It is very important that you also go and receive feedback from the people within the community. So remember and do that. And role play on communication skills is also good. So if you have opportunity, you can also play a role in communication skill, role play. You select some people to play a role for others to see. If you were to have a now one-on-one meeting, you should have tried as much as possible to play some of these roles so that others can actually see what we mean. Because when somebody come and speak in language that others don't understand, you see the reaction. In our classrooms, you have been seeing it all the time. When people are hungry, you are talking, you hear from one ear and get out of the other one. But when they are okay, they are happy and they are not hungry, you likely to see that everybody will follow you actively, whatever you are doing. So it is important that as a health educator, when you are going out, you take care of all of this so that people can actually follow whatever you are doing. Then you also have to look at the use of the audiovisuals. It is important that you also look at all of that. You must be familiar with them. If you want to use it, you must be familiar with them. If you are not familiar, you don't be able to use it. So be familiar so that you don't go and set the machine, then you become a laughing stock. They will be laughing at you. You are not able to even set this thing you are here to show. So at the end of the day, they won't take you serious. So you must also be familiar with the audiovisual you want to use so that when you get there, if you don't know how to use, that's why most of the time when people are organizing programs, they go first to test their machines because these are things that you cannot predict. So they go out first and test them in readiness for the program that they are coming to organize. So if you are also going to use any audiovisual in your presentation to make it easier for people to understand, it is your responsibility to also try as much as possible to do the testing first so that you get to know. It is important so that you look at all of this. If you are not sure of how to use it, let others who know how to use it help you. Let them help you so that you'll be able to what? Use it properly. It is important that you do that. Other than that, you see how the villagers or whoever you are delivering this message to, the way they will react to you. Then key visual aids at eye level. Sometimes some of us, when we want to project or the board on which you want to project, the thing will be above the eye level of people. So they have to raise up their head before they'll be able to what? Look at whatever you are presenting. It's not good. So always ensure that it's at the eye level, a level that when they sit comfortable, they can look at it. But when you raise the thing that people have to stretch and look up before, no, that is not good enough. So at eye level, they will look at it comfortably and follow whatever you want to say or you are doing. So it is important that you also consider that. It is very important. Also, ask for description of what they see. So when you are using audiovisual, to be sure that they have seen what exactly you have projected, ask them questions whether they will be able to tell you whatever you have projected. If they are able to tell, that means they are actually looking at what you are projecting. But if you have projected, how do you call it, Veronica Bucket, and they are telling you that they have seen a wood, that tells you that no, they are not seeing what you have projected. If you have projected, let's say, a mosquito net for them to see, and people are telling you that they have seen a bucket, that tells you that they are not seeing exactly what you have projected. Then there's something wrong with your image. So always it's advisable that after you have finished projecting, ask the people, can you see what I've projected? If they're able to tell you what you have projected, that means you are okay, you are on course. Then you must also clarify the misconceptions. Sometimes there are misconceptions here and there, especially in our setting, in our villages. That is why we still have a lot of challenges today. When you go tell somebody that, oh, if your husband died, you don't even go to widowhood rights, sleeping on the same bed with the person, nothing will happen to you. They won't take it because of their beliefs. They won't take it. Even look at when COVID came, look at the misconception that we had. What are some of them? Can anybody remember about the misconception about COVID when it came immediately in that March in Ghana? Do you remember some of the misconceptions that people said about?
That it was spread through 5G network.
Drunkard. Do you remember some people said that if you take Akpeteshi, there's no way COVID will catch you. So people were drinking morning, afternoon, evening, so that they will immune themselves against the virus. You remember? So a lot of things had happened. So you must be able to clear all these misconceptions. Sometimes HIV, people tell that if you get HIV, try and go and sleep with a virgin. The disease will not do anything for you. All of those things have caused a lot of damage to our society. So you must also try as much as possible to do away with this misconception, come out with clarification, to clear the doubts that people have in their mind concerning this condition that you want to educate them on. You must also talk slowly.
Yeah, please. There is conception in line with the visual aid. The misconception must be in line with the visual aid.
Hello? Hello?
Yeah, I'm saying that the misconception.
Yes. Yeah.
Hello.
Yes.
Misconception to correspond to the visual aid.
Okay.
That means what you are projecting.
What you are
there's a misconception.
Okay. Exactly. There's a misconception about it, yeah. So not necessarily about the values that I am talking about, but whatever you have projected as well, as you are saying. If people have some misconception about it, that is the opportunity for you to also come out for clarification. There are misconceptions about mosquito nets. There are misconceptions about this Veronica bucket and all that. So you must also come out clearly and explain those misconceptions about it, if there are any, about the things that you have also projected. Sometimes you can also encourage pregnant women to take some kind of food that you have projected, but in the community, they may have some misconception about it. In some community, they say pregnant woman, you cannot take snails. So you can also, if those are you are trying to project the kind of food that the pregnant women take, or the visual aids that you are using in their settings, those things are not used. You must also try as much as possible to resolve all those misconceptions that come along with the visual aids that you have projected, or the items within your screen that you have projected, for them to have that clarity, to have that clarification on them. And some of us too, because the way we talk, so that can also interfere with your explanations. When you talk to extent that they don't get it, and that can also affect the message that you are putting across. For example, there was some kind of evaluation somewhere that I've witnessed before, and then the student said that the lecturer come to lectures and you normally come and rap like Sarkodie. They don't get whatever he's saying. Yes, 1 minute. Yes, hello. Good evening. Yes, I'm teaching. Okay. So when you talk and then a student could not get you, that is also a challenge. So take your time, come to their level one after the other so that they can actually get whatever you are saying. It is important. Then maintain eye contact where appropriate. You know, public speaking is also something on its own. Even though you may not be looking at the people directly, just look just above their hair so that they know that, yes, you are looking at them. But when it's necessary, have eye contact so that they also know that, yes, you are observing them, you are looking at them. So that is very important, especially if you have populations that are not too many, so that everybody will think that, yes, you are focusing attention on them. That can also help you to discharge or carry out your message across. So when you maintain eye contact with them, you can also look at or observe their body language or their non-verbal communication clues, and that can also tell whether they are following what you are saying or not. One disadvantage of this Zoom lectures most of the time is that you are not seeing the student, whether they are following or not, you don't even know. This thing I'm saying, or somebody is logged on here, the person is in the kitchen eating, and all this I'm saying is sounding there in the bedroom or wherever. Somebody is in the washroom, and the phone is on the table, shouting. My voice is there. Nobody is listening to what we are saying. So you don't even know whether people who have logged on, they are listening to what you are saying. Or maybe 2 or 3 people will be listening. Others, they just want to be, because you want to see attendance, they log on. But when you have a physical environment you are presenting, you can see the people demeanor and see how they are reacting. Look at their non-verbal and see whether they are following what you are saying. That will give you the clue or the clear picture of what you are saying, whether they are buying into it or otherwise. So it is also important that you also make eye contact and see their movement. So allow questions. In fact, if you are teaching or you are educating and you don't allow for people to ask questions, how do they get the clarifications? So as a way of communicating, using your visual aids to help you to communicate, it is advisable that you ask questions. It is very important that you ask questions, allow them to ask their questions, and that can also bring what? More clarity. For example, if I am teaching on a topic that I know exactly what I'm talking about, I may speak 1, 2, 3. Most of the time, if you look at some of the notes I add, 1, 2, 3. You look at a questionnaire or interview, just 1 or 2 lines, finish. So if you don't ask questions, the rest I won't talk about it. So when you allow people to ask questions, things that are bothering them, you are likely to identify them and resolve them. And that is the beauty of your feedback. And that will give you feedback whether people are following what you are saying or not. So asking questions and responding is also another way of what? Getting the feedback from the people. We are likely to go off. So when we log, we'll look at the steps in communication for community work. If you have any question, when we log on, please, you ask before I continue.